Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I am going to teach you on how to mix oral rehydration solution. So sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. Thank you for your support, thank you for your shares, thank you for your comments. So please stay till the end of this procedure. You may learn something. During the examination, you may be asked or a question and instruction may be set like this. As a student nurse or as a public health nurse or as a community health nurse student, you are assigned to the children's unit at Maraba Health Center. You encounter a child brought in with a severe dehydration due to vomiting and diarrhea. And as a student nurse, your task is to demonstrate how to prepare an oral rehydration solution using salt and sugar to a group of mothers in children's units. Remember, this is health education. As a student nurse, public health nurse, or community health nurse, of course, procedure on a patient is different from health educating patients, right? So this time around, you're going to health educate a group of women, isn't it? So before you start that, you have to introduce yourself to the women. Remember, you have to greet them and introduce yourself just as a normal procedure. So for example, hello, good morning, how are you all? How are your families? How are your children? I hope you are doing well. My name is Nurse Clement and I'm here to help educate you on how to prepare oral rehydration solution. What is oral rehydration solution? Oral rehydration solution is a solution being made with salt, sugar, and water to replace lost fluids. As a result of vomiting or diarrhea in the body of a patient or an individual. So sit back, and if you have any question, can you kindly ask me the question after demonstrating how you prepare it, right? So women, when you want to prepare oral rehydration therapy, you must get your requirements. That is your supplies. You have to get your water, the water that has been boiled and gets cold, right? And you have to get your measuring jug, your sugar, be it cube in this form or the powder one, this form, and then salt, then your spoon and spatula to level the sugar. Remember, we are teaching a group of women, right? So you are going to boil the water. After boiling the water, you can get the water from running tap, from stream. Remember, you have to teach these women to use the available resources around them. Do not force them. Maybe they may not have money. Do not force them to go and buy bottled water. No. If they can afford it, why not? But if they cannot afford it, be it well water, running tap water, river water, make sure that they boil it to 100%, 100 degrees. They boil it very well and let them pour. Teach the women, pour the water inside a cup like this, inside a jug. Allow it to cold. After boiling, allow it to cold and wash your hand very well so that you not contaminate the solution that which you want to prepare and give to your child to replace the lost fluids that which your child has lost, right? So now the next thing is for you to what? Get your measuring jug. As you can see that I have 1 liter measuring jug, right? Then the boiled water that which you have boiled and now is cold, you pour it inside the cup up to 1 liter, that is 1000 mils, right? So now I have, as you can see, I have measured it 1000 mils. And in case you don't have this measuring cup at home, so you take this bottle that is what, 500 mils, isn't it? And measure 2 and pour it inside a bowl like this, right? Then you measure your sugar. So you pick up your spoon and spatula this way, right? Then I have my sugar here. This is my sugar and this is my salt, right? This is my sugar, this is my salt, and this is my cube sugar, right? So this is my spoon, isn't it? So women, as you can see, you measure the sugar 8 teaspoons and you level it with this spatula this way, right? You do it this way and you pour it inside the water. You keep doing it till you have 8 spoons. 7, 8. So you have 8 teaspoons of sugar. Then we measure salt. Salt is only 1 spoon. You also level it with your spatula, right? You level it this way, as you can see. Then you also pour it inside the water, right? Then you stir it. I hope women, you are seeing what I'm doing. You stir it very well. Make sure that you stir till the mixture is being dissolved in the water. You mix it properly. You keep turning and turning and turning till the sugar and salt dissolve inside the water. So now that we have made our oral rehydration therapy, then you, as the person that is making it, you get a cup, right, and taste it to see whether it is too salty or not. Make sure that the taste is like the taste of a tears, right? A tears that drop from the eyes. Women, do you understand? That is how the taste of the oral rehydration therapy will be, right? After, when you taste it, right, then you give your child, allow your child to drink, and after each stool, you make sure that you give the child also, right? Then make sure that should be the water for the whole day for the child. Do not give him another water, isn't it? So, and the next thing is for you now to make sure that this oral rehydration solution that you have made do not stay till after 24 hours. After 24 hours, kindly discard the water. And when you make it this way, make sure you have cover, right? Always cover it. Do not leave it open so that it's not contact. Flies will not touch it, or any dirt would drop into the oral rehydration therapy, right? So always cover your solution this way, right? Always cover it. Then women, as you can see, if you are using cubes of sugar, if you are using this type of cube of sugar, make sure that you use 5, only 5 cubes in 1 liter of water, that is 1000 mils, and a level spoon of salt, but 5 cubes of sugar, right? So when the solution stays for 24 hours, you discard it and prepare another one. This will help, as you give your child, this will help to replace lost fluids that the child lost during vomiting and diarrhea, right? So women, do you understand the steps? The step that which I've taught you now?
Yes, ma'am.
You understand? So if there is any question, you can raise your hand and ask me.
Yes, ma'am.
If you do have any question.
No, thank you, ma'am.
So do you understand? I hope if a child is having vomiting and diarrhea in your community, your neighborhood, or your child, you can be able to prepare this to prevent the child suffering from dehydration.
Yes, ma'am.
I hope you can do that, right?
Yes.
So is there any question? Do you understand?
We understand.
All right. Thank you for your understanding. Thank you for your time. Thank you for staying to learn this oral rehydration therapy today solution. I hope you go back to the community and teach other women on how to prepare this solution, right? Thank you. So now, after when you are done during OSCE, remember this is health education, right? So I am done educating these women. So the next thing during OSCE, you tell your examiner is that you tell your examiner, I'm discarding used equipment by rearranging them, because another candidate is coming right behind me, right? So you go and wash and dry your hands, right? After when you dry your hands, remember in this procedure there is no documentation, isn't it? This is health education. You have educated the women, so you are done. You end it by thanking the women as I've thanked them already, and you discard used equipment. Thank you for watching this video. Thank you for staying with me till the end. I really appreciate your time. I really appreciate the watches, the shares, the likes. Thank you very much, and the comments. So I wish you all the best if you're writing exams as a community health nurse, as a student nurse, as a student midwife, and as a public health nurse, student nurse. I wish you all the best. Thank you for watching my videos. Bye-bye.